I woke up 34 weeks pregnant today, and that means that I really need to start thinking about what I'm going to bring in my hospital bag. So I decided to do just a little video of what I recommend that you bring in your hospital bag as a labor and delivery nurse, because there's so many things that they give you in the hospital that you don't need to bring. So let's start with that. What do you not need to bring? Don't bring any diapers, wipes, or baby swaddles to the hospital. You could bring one if you want like some cute little pictures with a swaddle, but they will provide diapers, wipes, and swaddles. I would not bring a breast pump because usually hospitals have them and it's not really recommended to pump colostrum. It just isn't really able to be pulled out by the pump like you would want it to. Babies do a much better job pulling out colostrum. For mommy, don't bring witch hazel pads, dermaplast, regular pads, panty ice packs, or mesh underwear panties, because they're going to have all of that for you in the hospital. Some footage of what an OR looks like. So if you are going to have a C-section, then you're not going to need to bring an abdominal binder, because they will also give you one of those in the hospital. Even though I think I'll still buy a faja and bring that, because I've heard that those are much better in getting your stomach to go down and holding everything in after delivery, whether you're having a vaginal delivery or a C-section. You don't really need to bring a hospital gown because they're going to have those there. And if you're wearing your own hospital gown in labor and delivery, it's probably going to get a lot of blood and fluids and stuff on it, and you're not going to want to take that home in your bag. You're just going to want to throw it in the trash. But it might be helpful, like after delivery, to bring a robe or something. Like when you get out of the shower, you can just throw that on and walk around your room in a robe. Bring slippers to wear around the room. Do not walk around on those labor and delivery floors barefoot. I'm sure the hospital does a really good job of making sure that those floors are squeaky clean, but those floors get covered in amniotic fluid and blood and poop and all kinds of different stuff. Just do not walk around the room barefoot. It absolutely drives me crazy when my patients do this. Bring your own big water bottle. A lot of the times the hospital will give you a big jug of water, but sometimes they run out. Sometimes hospitals don't have that. So make sure that you're bringing your own big water bottle, because you don't want to be coming in and out of the room and constantly having to ask your nurse to refill your water bottle. So just bring your own water bottle, and then that way your husband can run back and forth and fill it up for you. In my labor and delivery, I'm going to bring my own comfortable pillow and blanket. And I know that it's going to get ruined most likely, but just to have that comfort of a really comfortable pillow and blanket, I feel like makes all of the difference. Hospitals have limited pillows and it's just not very comfortable. So you're already not going to be getting good sleep. So I feel like that's something that I would definitely think it's worth bringing. One thing that a lot of my patients absolutely love having is a heating pad, especially if you're trying to go as long as possible without an epidural. Having a heating pad is so comfortable. Like one of the ones that you can plug in to the wall and then put behind your back. These things are not needed. They're very unnecessary, but if you want to be really, really comfortable and get the vibes going, I would highly recommend bringing an oil diffuser, essential oils, and then battery operated candles, because if you're trying to set the mood and get in that mindset of making it as far as you can, as far as dilation without getting an epidural, this is going to help you so much if you have tools in order to get you there. If you're getting a sound machine for your baby, also bring that, because you can use it after your delivery for baby to put in the bassinet, and you can also use it during your labor process. Do not forget your shower stuff. So bring your body wash, your shampoo, your conditioner, bring even your razor if you want to, a loofah, your own towel from home. They will have towels at the hospital, but it's going to be a really good feeling if you have your own towel from home that you can use after you take a shower, because after you go through the labor and delivery process, you're going to have fluids all over you, blood, you're going to be sweaty, and it's going to feel so good if you can just take an everything shower and get all of that crud off of your body. If you forget your soap, all the hospital is going to have for you is washcloths and baby soap, so keep that in mind. Bring some pajamas that are super easy to put on and are loose fitting and soft and comfortable, and right after your delivery, once you're walking around and settled and transferred to your postpartum room and everything's good to go, then take a shower, get in your fresh pajamas, get all snuggled into bed, and then you can slip your baby in your soft pajamas and do skin to skin and just bond with your baby and breastfeed. They'll do the first bath in the hospital for our baby unless you don't want to. You can always opt out of it and do the bath when you get home, but you don't need to bring any baby soap, nothing like that. They'll have everything for the baby's bath in the hospital. And the main thing that you'll need is a going home outfit, maybe something really cute to take pictures in. Like, I want to bring a really pretty swaddle with a bow to put on her head. Some people bring like the little wooden signs that say welcome with your baby's name and the weight and the length, and that's just really cute to just set in the bassinet and take pictures while you're in the hospital. And then bring a going home outfit, just like a little onesie. You just need really one outfit because your baby is going to be naked pretty much the entire time you're in the hospital and just swaddled with hospital blankets. The nurses are going to be coming in and doing assessments. The pediatric doctors are going to be doing assessments. They're going to continue to get your baby naked, and it's just going to be like irritating to your baby. So just like having them in a diaper and a swaddle or two is just much easier. And then the last thing that you really need for baby is to bring your car seat. They will usually make you put baby in the car seat. They'll check the car seat to make sure the placement is right, and then they'll have you carry baby out of the hospital in the car seat. Another thing that you don't need to bring for baby is pacifiers, because they're going to have those in the hospital as well. They don't really recommend giving your baby a pacifier in the first couple days of life if you're planning on exclusively breastfeeding, because it kind of confuses baby with the nipple and it can cause regression with breastfeeding. And so what you want to do is make sure that you have a really good latch and that baby's breastfeeding well, and then introducing the pacifier. And of course, if you need the pacifier, you can't soothe your baby and nothing is working, like, don't just let your baby scream and cry. Just give a pacifier if you need it, but just try to prevent it. Don't just give it just to give it unless you have your latch down. Baby's already got breastfeeding figured out and is feeding well, like every 2 to 3 hours. So that's my list right now for my hospital bag. Sometimes it can get a little cramped, and you definitely don't want to be carrying a bunch of stuff into the hospital that you don't actually need and that you're not going to use. And when I actually pack my hospital bag, I'll try and do a video and film everything and do like a full checklist and everything like that. But this is just me kind of like being 34 weeks, starting to think about these things and just wanting to get ready, because so many times I've seen women go into labor a little bit early and they don't have a hospital bag, they're not ready, and they're rushing. And so I just wanted to start brainstorming and create myself a list and kind of start getting a little bit mentally prepared since we've reached the 34-week mark. If you guys can think of anything else that was super helpful for you to like just get through your labor and delivery process, or just like must-haves that you brought with you to the hospital that you swear by and couldn't have lived without, then drop them below in the comments. And once I pack that hospital bag, I will see if I can link it to this video and below in the description. If you're watching this, that probably means you're getting to the finish line of your pregnancy, so congratulations in advance, and I will see you guys in the next video. Bye.